If you've had a total knee replacement, you'll want to do everything you can after leaving hospital to give you the smoothest recovery and return to function.
Hi guys, it's Dr. Adam here. I'm an orthopaedic surgeon. In this video, I'll go over 3 common mistakes I see people making after total knee replacement, which can really slow down your recovery.
If you find this video helpful, remember to check out some of my other content and hit subscribe for more videos coming up soon. As always, this video is for information purposes only, and you should speak to your doctor before making any decisions about your care. So, mistake number 1, doing too much too soon. Now, you might find this a bit confusing, as you've probably been told it's really important to keep active and move your knee, which is also true. So, what should you be doing? Resting the knee or moving it? When you have surgery, it's a huge trauma to your body. The soft tissues and bone around the knee are cut to do the knee replacement. So even though the source of your arthritic pain has been removed and you have a new knee, your body thinks you've been injured and it sets up an inflammatory response, and inflammation causes pain and swelling. The inflammation peaks in the first 1 to 2 weeks after you've left hospital and are at home. If you overdo things during this time, it doesn't give the knee a chance to settle down and can actually make the swelling worse, which makes it harder for you to bend the knee. So, in that first week especially, it's really important you ice the knee, elevate it, and allow things to settle by not doing too much. Otherwise, the swelling may worsen, which makes it more painful and even less likely you'll be able to move it. So, does this mean you shouldn't move it at all? Definitely not. It's still really important to use the leg, walk around, and gently start bending the knee, and also do ankle pumps. This stops the muscles and new knee joints from stiffening up, and it breaks down early scar tissue that starts to form. It's also important because if you don't move and the blood in your legs isn't moving around, you increase the risk of getting a DVT or blood clot, which is both painful and can be really dangerous if it breaks off and travels to your lungs as a pulmonary embolism. So it's a balance. You need to start those early exercises, but you shouldn't be trying to do 10,000 steps a day in that first week. I usually say that in the first week, for every hour of the day, for half an hour you need to be resting, icing, elevating the knee, and for the other half you can potter around the house to the kitchen or bathroom and back and do some gentle exercises. After around 1 to 2 weeks, when you feel the inflammation starts to settle and the pain is improving, that's when you really need to start working hard on bending the knee. And this is important as well, because if you don't manage to get enough bend in your knee by around 6 to 8 weeks, it can be really difficult to get this afterwards as scar tissue starts to develop. And your surgeon may even recommend that you need to go back to the operating theatre for your knee to be pushed or manipulated under anaesthetic. So early range of motion is important, but the issue is that trying to force the bend and using the knee too much in the first few days is counterproductive as it increases swelling, which makes it harder to bend the knee. You shouldn't have to go through the journey alone, and your physiotherapist and surgeon will be able to guide you and make sure you're on track. Mistake number 2 is not getting on top of your pain. During a knee replacement, surgeons usually put lots of local anaesthetic into the soft tissues around the knee, but as this wears off, the pain can start to kick in, and often this happens on the first night after surgery, so you need to get ahead of the pain and get those painkillers on board. Whilst you're in hospital, make sure you're comfortable with the painkillers you're prescribed and that they don't cause side effects like dizziness or nausea or vomiting, so you can tell your surgeon before you leave and they can adjust them if needed. Staggering the painkillers also helps. Depending upon which ones you're taking, rather than having them all at the same time, leave a couple of hours gap between them and take them before your physiotherapy sessions. Finally, failing to prepare is preparing to fail. Some of the things you need to think about are shopping. You'll probably struggle to get around the supermarket, so either stock up beforehand, get someone to help you for the first week or two, or arrange a delivery. Think about whether you can live and sleep on the same floor in the first week to avoid stairs. If you need any modifications, such as raised toilet seats or handrails, and when you can drive again. Driving is really difficult to give an exact time frame on as to when it's safe, as this varies from person to person, and it also partly depends upon which knee is operated on. You need to be able to safely control the vehicle and brake quickly if you need to. If you've had a right knee replacement, because you brake with the right foot, it can take slightly longer. And if you have a manual car, and even if you've had a left knee replacement done, this can be an issue as you need the left foot to use the clutch. I hope you found this video helpful. Please remember to like and hit subscribe for more videos coming up soon.